Where can Canada find more doctors and nurses to work in our struggling healthcare system? Part of the answer is right under our nose here in Canada. SecondStreet.org research shows there are literally thousands of doctors and nurses who get up each day and drive across the border to work in the United States. Today we're going to find out why and what we can do to convince them to work in Canada.
My name's Angela Henry. I'm a registered nurse. I work in downtown Detroit and I am living in the Windsor area. In 2005, I was working in Toronto at a major trauma center. I just needed a change. I was frustrated with healthcare in Ontario and the direction of my career. So I decided to become a travel nurse and I went out west to San Diego. And then I came back to the East Coast, but decided to stay in the U.S. just because of opportunities with my career.
Angela is not alone. SecondStreet.org obtained data from the Michigan State Licensing Board and was able to calculate that approximately 1,900 nurses live in Ontario but commute to Michigan for work. Nationwide, there are over 8,600 cases where border states have issued licenses to nurses with Canadian mailing addresses. We don't know how many actually commute to work in the United States, but we know it's happening, especially in provinces like British Columbia, Ontario, and Quebec, where there are large populations near the border. SecondStreet.org surveyed the nurses in Ontario who work in Michigan and asked, "Why did you choose the United States?" The number one reason was availability of work. Many told us they couldn't find full-time jobs in Canada and didn't want to work part-time and have to chase down extra shifts all the time.
What would attract nurses to stay in Ontario? Flexibility in scheduling. First of all, I'm in a full-time position. When I interviewed in Windsor, they offered part-time. I preferred to know that I'm in a full-time job, not waiting for hours. In the US, I found that I've had self-scheduling where they give me the schedule that I want. I don't have children, but I'm taking care of my parents, and I need that work-life balance. That's really important to nurses.
The second most common reason why Ontario nurses chose to commute to work in the United States was compensation, followed by working conditions. SecondStreet.org also spoke with Cheryl Cassio, a nurse who has been commuting from Ontario to Michigan for over 30 years. She also raised similar concerns, including a lack of full-time work.
It's a problem because Windsor or Canada or Ontario or whatever, it's just not offered. You may get a part-time job, and you're lucky if you do, but then you don't get full-time benefits or anything like that, and I don't want to work a couple jobs. I want to work one job and put my time in, take care of my patients, and come home.
Government-run hospitals in Canada could try to recruit some of the nurses who have left. They could begin by trying to fix some of the problems they raised about the government system. However, we can't forget that private clinics could also recruit some of these nurses. After all, many provinces are now paying private clinics to provide healthcare services to the public. Those clinics will also need to hire nurses, so there will be more job opportunities and more choice in terms of where to work. And because private clinics are not bogged down by government and union bureaucracy, they may be more flexible when it comes to offering nurses full-time work, the shifts they want, and better compensation. Angela and Cheryl think more private options in Canada are a good thing for patients and staff.
I do believe we need hospitals, of course, and we need adequate staff to keep it going, but at the same time, I do feel that we have to take a bit of the load off of the hospitals. So I don't object to private clinics that can focus on one thing, such as orthopedics, and take the weight off of the hospitals.
It's a great idea as far as like an outpatient surgery center, specifically is what I'm talking to. In regular clinics or things like that, yeah, we definitely need after-hour clinics. You know, so maybe our ERs won't be so jammed, you know, and I think what they were mostly speaking to before is because of the backlog of surgeries and things like that, is having those outpatient clinics would take that burden off, and most definitely it would.
I think it's important to really look at the value nurses have, and when you do have nurses who bring to the table great care, you want to keep them. And I think you have to update and modernize your thinking and be flexible as to how you're going to keep nurses in the system in Ontario, and look at pay.
I would love to practice in Canada. I would love to be able to wake up, 20 minutes before my shift or an hour before my shift and go and do what I had to do and have like a 5-minute drive home, as compared to crossing a border and driving over in the States. That'd be nice.
If you'd like to learn more about healthcare reform and our research on Canadian healthcare workers working in the United States, please visit secondstreet.org, and don't forget to hit the subscribe button.